Becoming pregnant comes with many questions about the process and most importantly about the birth. Newswatch anchor Serena Davanzo talked to a local midwife to help answer one of these questions.
Many women who are preparing to have a child have the same question: where can I give birth to my child safely? Most think of going straight through the hospital, but there are other options.
There's unassisted births where people give birth at home without a provider. There's assisted births where people choose to give birth at home with a provider. And then there's births where they were planning to give birth at a birth center or hospital, but gave birth at home instead.
There are many reasons a woman would choose a home birth instead of a hospital birth.
There's been a lot of studies actually that look at why people choose home birth. A lot of it has to do with comfort, being in the comfort of their own home. It has to do with safety statistics about it being safer for the mom at home. Another reason a lot of people like to choose the care, not just for the home aspect, but we spend more time with them in the clinic than they typically get. And when they see me in the clinic, I'm the one that's going to be there at their birth. And so they get to meet me, see me over and over again, get to know me, I get to know them, right? And that improves their comfortability. So a lot of complaints come with those who are planning to deliver in a hospital and they're not sure which provider they're going to get. With us, or typical home birth, you know your provider, you know exactly who's going to be there.
According to the CDC, in 2022, home births have reached their highest level since 1990. Most of the home births are with a midwife. Midwives do a risk assessment around 37 weeks to deem if a pregnancy is considered low risk. According to Nunley, 85% of births in the U.S. are considered low risk.
Low risk people are more likely to have a successful vaginal delivery without complication at home than they are in the hospital. There's less likelihood for morbidity, and babies have higher APGAR scores. Some studies have shown anyway, higher APGAR scores at home and a better time transitioning to that environment than they do in the hospital. So a lot of people want to choose that, for safety reasons as well for them and their baby.
According to a 2009 study in the National Library of Medicine, perinatal and neonatal mortality rates were low for both hospital and home births. If you're interested in more information, you can visit Gentle Care Women's Clinic. In Mount Hope for Newswatch, I'm Serena Davanzo.